Namaskar. In our lungs, we have different sets of muscles which are helping lungs to expand and reduce its capacity. Now this expansion and contraction, this is done at various levels. One muscle which is called as intercostal muscle, which is holding our ribs, that muscle we hardly use in our life. That muscle which is expanding our ribs from side. If you see a frog when it breathes, it goes like this, that's side muscles, and that is called as intercostal muscle. This intercostal muscles need to be trained. We have to start using this intercostal muscle when we take deep breaths, and that would really help improving our vital capacity of lungs. And so this is pranayama number 2, pranayama for intercostal muscles. Pranayama number 2 also has to be done with equal breathing. Inhale, exhale, but inhale using only intercostal muscle, exhale only intercostal muscle. Usually I have observed that when we start taking a long breath, we start using other sets of muscles. In that case, we will not be able to train this intercostal muscles. This muscle is from the rib, full rib, from front to back. Now it needs to be observed well, mind should be really focused well, then only you will be able to train. So here we are taking help of our hands. Our hands have to be there on our ribs, and we have to first focus on the frontal muscles of ribs and expand it. Mind should be really focused, otherwise you won't be able to do that because you are never doing it. So expand it, then try and hold your thumb, join your thumb from back, and see that the back muscle also gets trained to expand, and then finally keep the hand at the center and feel the expansion in front as well as at the back region. So the whole rib is getting expanded from side and coming back. Inhalation, exhalation, inhalation, exhalation. This is how we have to start training our muscles. What happens is in asthma, people are breathing very hardly from here, clavicular region. Person is little affected, can't breathe well, can't breathe out well. So this breathing struggle is going on. Here if person knows intercostal breathing and person starts doing that while bending forward, the whole attack is released. So bend forward and do intercostal breathing, but that you could do when you have attack. But for learning, stand straight and exactly understand what this muscle is and use that muscle properly. So when we say breathe in, you should be using your diaphragmic muscle, intercostal muscle as well as clavicular muscle. The set of all these 3 muscles is inhalation. So this is how we will improve the vital capacity of lungs. We would improve the oxygen, more oxygen into our body, and naturally improve general health condition because you are breathing correctly. So try and master this intercostal breathing. Here we are quite ignorant about, and so do it well and take benefit from this pranayama. Pranayama number 2, intercostal muscles. Namaskar.